We have a special guest with us today. Dr. Ben Johnson is a friend, and he is the chief editor of Nature Health, a new journal of public, global, and population health from the Nature portfolio, launching in January 2026. So this is really a historic moment. Ben introducing his journal to the world, chose to kindly come to the United States and come to New York to spend time telling us about his new journal. And we are amongst the fortunate few. Ben, as you know, has a PhD in infectious disease and conducted research in virology and vaccine research at Public Health England, now the UK Health Security Agency, and Imperial College in London. Prior to academic publishing, he also holds more than 15 years of experience as a journal editor and science communicator. I've experienced that in person. He is mindful, he is an analytic thinker and thinks very much on his toes. And you may consider that just a new member of the Nature family, but a journal such as Nature does not start a new journal just like that. The implications, the risk taken, the political ramifications of starting a new journal are enormous. In any journal, Nature is an example. Nature, as you know, is a huge family of journals covering such a broad spectrum of science and knowledge. And we in public health feel like sometimes an orphan child, where our research, our publications are part of larger journals that are not specialized in our domain of scholarship and research. And so to welcome a new journal such as this, I can see all of you came here celebrating this historic moment. And I, in person, think tremendously of this opportunity for us and for other researchers in population and global health to find a listening ear and a specialized group of editors who are supportive of our scholarly endeavors. I personally welcome Ben amongst us today. I hope you feel well received by our community. They are eager to listen to you. Not always do we have a full room, so that's also perhaps an expression of your future authority. But having said that, I will say that we welcome you as a friend and as a colleague and congratulate you on this wonderful achievement as the chief editor of this new journal. Welcome, Ben.
Thank you, Ayman, and thank you for that lovely introduction. I'm on a tour of schools of public health at the moment. So I did Hopkins last week, Columbia yesterday. Tomorrow, I'm getting the train to New Haven, so I'll go to Yale and then end at Harvard. This is the biggest audience I've had so far, so you're off to a good start. And also, I do feel a kind of personal connection with City University of New York for two reasons. Firstly, I have had dinner with Ayman no fewer than 4 times in the last month. In Washington, DC, in Berlin, and tonight in New York. So I'm going to have to declare that as a conflict of interest at some point as a journal editor. But also I work but also I work very closely with Dr. Scott Ratson, who's here for the Nature Medicine Commission, because I was previously at Nature Medicine for 4 years on quality health information for all. I've also edited piece by Jeff Lazarus, so there's a number of familiar faces in the audience, which is not always guaranteed when I give a talk. So I've kind of got three Thanks. So I've got three parts to this talk. I'm going to start out explaining why we're launching a new journal. As Lyman said, it is a long process. It was at least a three-year process. I mean, the journal's been discussed for about 10 years at the Nature portfolio, but the time was finally right. So why we're launching this new journal and what our vision is and what we're hoping to achieve. And then I'll talk a bit about real world impact and what we mean by that and how as a journal we're trying to achieve real world impact, because that's a relatively unusual mission for a nature journal. And then I'll finish with some hints and tips, mainly for kind of junior faculty, PhD students, postdocs on how to get your paper published in a nature journal or elsewhere. But I start with this slide, usually when I give a talk, which is why is medical publishing important? I don't know if you can move that bar at the top, or if that's always. There we go. Thank you. Why is medical publishing important? Why in 2025 should you send your research to a scientific journal? Why not just publish in a preprint or publish on your university website? Well, medical journals have a really key role. They provide evidence-based information, they inform clinical practice, healthcare guidelines and public policy, but also information is a determinant of health. So your ability to access information underpins the social determinants of health and impacts health-seeking behavior. And this is a piece we published when I was at Nature Medicine from authors at YouTube Health, who spent a lot of time thinking, how can we surface quality health information? Because if someone creates a video on YouTube about health and there is no evidence behind it whatsoever, it tends to do very well. In contrast, if there is a huge amount of evidence, it tends to do less well. And this is something that social media companies are very aware of. And in the past, we're very interested in trying to combat. And we have a role there as well as editors of scientific journals. And many of the challenges to facing society affect health. So we think about these at the Nature portfolio, and we try and think, how can we publish research to tackle these challenges? This is from the World Economic Forum. This is survey data on global risks ranked by severity. It's probably too small for you to read, but at the top is misinformation and disinformation. But most of these affect health. So you have extreme weather, conflict, pollution, inequality, involuntary migration. And so if you're a policymaker and you're hoping to have evidence-based policies to tackle all of these challenges, you need access to quality information, to evidence, which will help you address these challenges. And really, we realized at the Nature portfolio that we were not very well equipped as a publisher to publish the research that could help tackle these challenges. As I mentioned, mis and disinformation about health is widespread, not just on social media, but that is a particular concern. But health disinformation is nothing new. This is a cartoon from 1851 from London by a cartoonist called James Gilray, who was an influencer, content creator of his day. And these were printed on pamphlets that were sold very cheaply on the streets of London. This is the printing press as the social media of its day. And this is a lady in the middle receiving smallpox vaccination. And all around her, people who've received this vaccine are sprouting cow heads, cow horns, cows coming out of their mouths. And this was not an anti-science cartoon. This was reflecting real concerns that people had at the time. It was not, the original smallpox vaccine was not a particularly safe vaccine. Some people did die after receiving it. It was grown in cows. We still use the word vaccine today, which derives from the Latin for cow. So people knew this was a new substance that was potentially dangerous with some potential benefits produced in cows. And I always include this slide because I think it's very tempting to think that people are perhaps anti-science when they show, fear of vaccination. But actually, these are often real fears that people have. Many people have real fears about mRNA vaccines. And as researchers or as someone in publishing, we need to listen to these genuine concerns. Sadly, attacks on scientists, which are very much in the news, are also nothing new. This is another cartoon, slightly later. This is from 1904 from Brazil. And this shows a real life event, which was the Revolta da Vacina, which was a riot protesting against compulsory smallpox vaccination. And on the right is kind of represented the people, and the guy in the middle who's kind of riding a giant syringe, which didn't really happen. But in the middle is Oswaldo Cruz, who, if you know Brazil at all, the main public health institute is named after him now. Um, this is symbolizing the people not wanting this vaccine that Oswaldo Cruz was promoting, this potentially life-saving vaccine. And this was a successful protest. This was a successful riot. Mandatory smallpox vaccination was abandoned in Brazil after this event. And academic journals have always had a role in educating the public. If you go back to Nature's launch in 1869, you may think of Nature as a journal for scientists. Well, we didn't really publish any original research that you'd consider a modern research paper for the first 30 years or so. Our primary goal in our mission statement was to place before the general public the results of scientific work and scientific discovery. And secondly, to aid scientists themselves. And in some ways, we've lost that mission as time has gone on and concerned ourselves primarily with scientists. But we're trying to regain what was our original mission to make sure that the public are well informed about all of science. So we publish across all areas within health, medicine, science, technology and medicine, social sciences, engineering. And these are a bunch of nature journals, most of which were launched relatively recently, from health and medicine to climate change and sustainability. This is our newest journal. So as Simon said, we've not published anything yet. Our first issue is January, and it's a journal of public health, global health, population health. So we did consider, should we call it Nature, Global and Public Health? Should we call it Nature, Public Health, Nature, Population Health? In the end, shorter is usually better. And I think we picked the right name because I'll show you the kind of papers we're receiving, and it really is across the breadth of health and really outside of what you would consider health or biomedical sciences. And we're aiming to bridge the implementation gap, which I will talk about, from research to policy and practice. And we're prioritizing research conducted in resource limited settings. That could be a low or middle income country, or it could be a low income neighborhood here in New York City. So this is some inside info on Nature Health, how we're doing. We've had more than 1,000 submissions since we launched the website in April. This is a new record for a Nature journal. So it's only me and 2 team members. So this is, I mean, it's not for you to know the challenges I have in reading all these papers, but it's a lot. It's a lot to read. I've got a 3rd team member joining me in January. I don't think you can see very clearly the chart on the left, but this just shows the range of topics that we've received. Actually, that's the range of topics we've sent out for review. So we've sent out, this is slightly old data now, but 181 papers at that time. So we're sending out 18% of papers, which is about usual for a Nature journal, between 15 to 20%. The subjects, in terms of what we're sending out for review, the main subjects are epidemiology, health AI, and environmental health. But we also have health policy research, quite a lot of infectious disease modeling, some biomarker studies, climate health, intervention studies, digital health. So a really broad range of topics. on the right, this is our geographical spread in terms of submissions. This enormous kind of part of the circle here is China. So we've had a lot of interest from researchers in China, very good quality papers from China. This slightly smaller chunk here is the US, so that's why I'm here. It'd be nice to get some more submissions from the US. This looks a bit more evenly spread if you look at the papers we've sent out for review. This is based on submissions. But this just gives you a flavor. We are a global journal, so we want this to be multicolored, kind of rainbow circle. And we have had some content from low and lower middle income countries, which is a priority in terms of outreach. So the scope really splits four ways, and this was the vision that I had a year ago now. And this has been achieved in terms of the volume of submissions. So public health, global health, digital health, and environmental health. So very strong interest from climate health researchers, digital health, AI health researchers, which we're very pleased to have. I was at Nature Medicine before, and the digital health editor at Nature Medicine moved with me to Nature Health. So we really have a very strong interest in that topic. So we're aiming to publish research that understands the causes of human disease, as you would expect, and treatments, but we're really focused on cost-effective, sustainable treatments, particularly if they work in a community setting. What we tend to reject as out of scope is content that is overly biological or mechanistic, although that we do have some papers around biomarkers, or research which is overly clinical, because really that sits with Nature Medicine. Although we do have some kind of hospital-based AI diagnostic papers that we are sending. But the core is population health, scalable, sustainable interventions. What that means is that the core of the journal, we have a lot of papers which are biomedical science, but solutions or research may come from the social sciences, environmental sciences, computer science, architecture, town planning, policy, economics. We're really very broad in terms of solutions, and we're thinking of kind of health beyond medicine. So that's kind of my journal in a nutshell. And then I'll talk about real world impact, because this is very much a central goal for the journal. And that's not usual for a nature journal. Usually nature journals are thinking of kind of the first, the biggest, and the best. And what we're focused on is we want this research to have a real world impact on health. And if any of you work in the more environmental sciences, you may know a journal called Nature Sustainability. And we're really trying to do something similar to what that has done in terms of impact on policy and impact on practice. So that's whenever we're reading papers, we're really thinking, is this going to have, we want it to be rigorous, we want it to be original, but is this going to have a real world impact on health? So this is the kind of ideal situation where research is informing policy and policy is informing practice, but we know that that isn't always the case. That could be because you have a policymaker who is not interested in evidence, but it could also be that the evidence is not surfaced, they're not reading the evidence, it's not easily available to them. So on the left, this hasn't come out very well, but you'll all know this because this is the kind of hierarchy of evidence, with meta-analyses of clinical trials at the top and anecdotal reports and observational data at the bottom. This is all well and good, but policymakers don't tend to read this content. And it's kind of part of the human condition that we often prioritize stories and anecdotal reports. And this is a big challenge for policymaking in general. I'm just presenting some challenges. So another challenge is that the causes of disease are complex and they are often emerging. And I've just put 4 examples here. So microplastics, kind of health consequences of extreme heat versus extreme cold, alcohol, as to whether there is a minimum unit of alcohol which doesn't cause harm, and health risks of hormone replacement therapy. And these are all areas where there is a degree of uncertainty amongst epidemiologists, and they're all reading the same evidence. And so if you have epidemiologists, if you take, for example, microplastics, we have observational studies, for example, published in Nature Medicine. You can detect them in the brain, in the placenta, in atherosclerotic plaques, but are they causing any harm? We don't know, right? We don't really know. So this is an emerging health hazard. How are you supposed to legislate, or what regulations should you have when we have so little evidence? Alcohol is, I think, a really interesting example, because there is disagreement as to whether, and health guidelines vary in different countries, as to whether there is a kind of safe amount of alcohol that you could drink. And we've received a paper on this at Nature Health, and everybody's looking at the same evidence, but you can interpret that evidence slightly differently. So epidemiology, in a way, reminds me of Churchill's remark about democracy, that it's a terrible system until you look at all the others, right? So it's the best tool we have, but it's sometimes very difficult to look at the evidence and say, well, this is the policy recommendation. And so we're thinking a lot about this at Nature Health in terms of publishing the best quality evidence and using new technologies or new methodological approaches, particularly around things like causation, and really trying to advance the field of epidemiology so we can get closer to what would be useful advice for policymakers. So I've kind of got the next few slides are kind of three recommendations, which is three things that we're thinking of at Nature Health. Three actions, they're kind of actions for me and my team, but I think they're also relevant for a public health audience and for a medical audience in particular. One is to embrace the social and behavioral sciences. Because biomedical research alone is not sufficient to improve health. And I was reading a paper just this week about physical activity. So there's been a huge, if you look, most countries around the world, more than 90% have clear policies on physical activity. And that's a big policy success story. So evidence to policy working well. Global physical activity has not increased over that 20-year period. So you have the policies, but they have failed to really have meaningful action. Why is that? Well, you can only understand that through the social and behavioral sciences. There's lots of examples here where we need to understand human behavior better. So we are interested in this as a health journal. We will publish that kind of research. So, for example, we do have some social sciences papers under review at the moment, and this might be qualitative research. It might be survey data. It might be a mixed methods approach. All of that is in scope for us. And the solutions might come from fields that feel a bit disconnected to health, like town planning or architecture or housing. But it's worth reflecting, and a public health audience here will be very aware of this. But I was at an aging conference earlier this year, and there was lots of talk of kind of pharmaceutical interventions, most of which have only evidence base in animal models, right? And so these are the things that are going to help us live longer. But if you look at human history, what are the interventions that improved aging the most? It was sanitation, right? Clean water, or interventions around housing, town planning, around how cities are organized. Those are the public health interventions which have had the biggest impact, as well as vaccines. So storytelling I put on here because I think researchers need to become better storytellers, and that doesn't mean that you abandon facts, but stories that include those facts can be more persuasive. And I put a plug here for the commission, which Scott Ratson and I are involved in, which is the Quality Health Information for All Commission that's had a lot of interest. which is trying to think about who should be communicating health information and what are the effective ways of communicating that so that people live healthier lives. I think researchers need to be better rewarded for communicating their research, which isn't always the case. And there probably are lessons that we can learn from social media and social media influencers. We're also thinking at Nature, um, I think it's not sufficient now for us to just be publishing your research. We need to be communicating that research and making sure that whoever is your target audience, whether that's researchers or whether that's policymakers or whether that's practitioners or people in education, can access the paper that you're publishing. So we have a role there as well in terms of helping you to craft your stories. And then thirdly is about involving patients and communities. So this is just kind of has so many benefits if you involve communities. And all of you will know the Declaration of Helsinki. If you do any research on humans, you have to say somewhere in your paper, this research was done in accordance with the Declaration of Helsinki. Well, as of this year, the Declaration of Helsinki now requires meaningful engagement with potential and enrolled participants in their communities. So there's been a big push for this for a number of years. There's good ethical reasons why that should be the case, but also if you're co-designing your research with communities, then it's much more likely to have a real world impact. It's much more likely to be sustainable. It's much more likely to be health benefits. If you're working with patient groups, they will tell you what their needs are. So that can feed into the design of your research. But also, if we're thinking again about real world impact, it's often your community members who are the most powerful advocates. So if you want your research to have real world impact, well, you can turn up to a member of Congress or to somebody else and say, well, this is the research I've done. But if you have someone with lived experience of a disease or a health condition, they are way more powerful than you usually. And so those community members who you've involved in the planning and research are really, really powerful advocates. And we're also thinking the nature journals, how can we involve communities more in what we're publishing? We do occasionally publish opinion pieces from patient advocates, community advocates. So I'm just going to finish with a few slides, kind of hints and tips, which I hope will be useful on how to publish your paper. They're mostly kind of frequently asked questions that I get. And we really see that we have three main roles at the Nature portfolio. We're all full-time editors, so we all have PhDs. There's the occasional MD, although not many. And we all work full-time as editors. So we see that we curate, we enhance, and we amplify your research. So curating, this is often the reason why people may be unhappy with us. We reject a lot of papers. So our journals are selective. We aim to publish the most impactful research. These numbers are from 2021. So there's a new version of this coming out this year. In that year, we received 67,000 submissions to the Nature portfolio, across the portfolio. And of those, 10,000 were sent out for review and 4,000 were published. But if we reject your paper, if we can see that the paper's well done, but maybe it's out of scope for us, or isn't a good fit for the particular journal you send to, we will offer you a transfer. So these kind of bubbles at the top are transferred papers. So another 18,000 were reviewed at another journal. At another vigorous gesticulating at another journal, and another 4,000 of those were published elsewhere. So we will often try and find a home for your research elsewhere. So enhancing, it's not just me as an editor or my team. We have a big team of people, a big department of people in different teams. We have an art team, We have the press office, we have production, we have copy editors, and there's really a lot of people who work across the portfolio. This is just an example figures. So on the bottom, this is a real example. On the bottom left is the figure as submitted. This is a great figure that we like to see because it's very clear, it's very easy to understand. And then on the right is the version created by our illustrator. So I can take no credit for this. This is all done by our full-time team of illustrators who are really talented at what they do. So the idea is the paper comes out better after it's been through the journal. We also amplify and disseminate. So we have a very active press office. We're active on social media. I think in 2021, there were 100,000 news stories around the world from papers published, from those 4,000, 8,000 papers published in the Nature portfolio. So really what we do is we guide your paper through from submission through to peer review. This is just a kind of bunch of the roles that we have. And as I mentioned at the start, we normally send out between 15 to 20% of papers and we publish about 5 to 10%. Those numbers are fairly consistent across the Nature portfolio. This is a question I'm often asked, how to deal with reviewer 3. So you might have, this is very common, you might have 2 reviewers who really like your paper, they're very constructive, and a 3rd reviewer who didn't like it at all and wishes you'd done a whole bunch of different research. So as I say, this is very common. When I'm handling your paper or my team are, we are ideally, we are giving you some feedback on what you should do, what you don't need to do. It's quite common that the reviewers may ask for some work that we don't think is necessary. So we will guide you on that. If you're not sure, you can always email us to ask. And we really encourage you to do a point-by-point response. So explain what you've done, how you've responded to comments. And if there was work that you don't think was necessary, then just say so in your point-by-point. And quite often that's absolutely fine for us. And it's not a democracy, so the reviewers don't vote. In the end, we do sometimes overrule reviewers if we've got a very clear reason for doing so, and we would explain that to the reviewer why we were doing it. You could always talk to us. You can always send a pre-submission inquiry. I always recommend people use the cover letter. That's most useful for putting your work in context. So if it's Nature Health, it's what is the real world impact of your paper? Because that's what we're mainly looking for. If it's Nature Medicine, then it's what is the clinical impact? What's the benefit for patients of your research? We do make mistakes. So we may have rejected your paper and you may think that it's based on a misunderstanding, or I had a case very recently where I felt that the volume of work required was too large for a revision. So I rejected the paper and said, well, if you can do all of this, then feel free to appeal. They'd actually already done all of that work. So they'd been busy working on it. So the appeal was successful, and that's one paper that is now ready to accept. So you can always argue your case, but always focus on the science. Try and address the concerns raised by the reviewers. We'll usually get back to you within 3 weeks, and we'll discuss the appeal as we discuss all decisions amongst the team. So another question I get asked quite often, can early career researchers publish in Nature journals? Yes, you can. We don't formally assess who you are or the institute where you're based. And if you're concerned about that, you can request double-blind peer review, and we get those requests quite often. So there, if we ask that you take your name and affiliations off the paper, and the reviewers don't know who you are, and the idea is they're just assessing the quality of the research. We don't offer that for clinical trials because that doesn't conform with the consult guidance on clinical trials. The only exception to not caring where you're based is if it's research conducted in a low resource setting, and then we would ask for authors from that setting. So if it's in a low or middle income country, we would want researchers based in that context. That's across the Nature portfolio. That's to avoid what's sometimes called helicopter research, where researchers from high-income countries fly in, conduct research, and then leave. This is completely normal practice until relatively recently, but as a publisher, we see that we have a role to stop that practice so that there are local collaborations in that setting and long-term benefits for those communities. So that's the only exception where we kind of care where you're based. And if you don't think certain people, maybe your main competitor, will treat your work fairly, you can ask for those reviewers to be excluded, but don't ask everybody in the field to be excluded, or we'll struggle to find reviewers for your paper. So I've been talking about research content, but we publish a lot of other types of content. And at Nature Health, we'll be publishing an equal volume of research with opinion content, reviews, perspectives, commentaries. These are just some examples from Nature Medicine. So maybe you have an idea, a kind of big picture topic, an emerging area within your discipline. You can always email me and we'll get back to you very quickly whether we're interested in publishing that. And there are various people in the room who've published opinion pieces in Nature portfolio journals. So that was all. That was my talk, and very happy to take any questions. And do feel free, my email's on there, so do feel free to email me afterwards as well.
People can raise their hand in the room. We have about 40 people online.
Oh, great.
Okay, direct their questions to the back, and that will be transmitted to you. So, may I answer the first question?
Of course.
We really welcome what you mentioned regarding the importance of impact of research as an important component of how your journal would like for itself to be known. And the question here is, how do you see the impact of your journal in terms of influencing policy? And are there any ways you can measure not just success, but also your accountability in perhaps supporting good policies related to publication?
Right. So should I repeat the question for the people online, or can they hear? Yeah. Okay. So the question was how do you measure the real world impact? I mean, in a nutshell, that is a challenge. You know, it's really easy to measure citations and accesses, which is what we would traditionally measure success, which, you know, the number of citations per article, that's your impact factor, and that has a kind of outsized importance. So there's a few options available to us, but it's not easy to measure real world impact. One of the things which Nature has started doing, the kind of the mothership Nature, is they email authors. This is for opinion content they publish. They got a sense that if you publish a commentary in Nature, it may have a real world impact. So they do a survey with their authors, because you are likely to know as a researcher if the paper you've published had a real world impact. That's one thing we're thinking of. There are some tools in terms of policy papers. So there's the altmetrics donut, you may know, which appears on all of our articles and across other publishers as well. That will track some, it's not perfect, that will track some policy papers. So if a scientific article has been cited in a policy paper, it will track some of those. But I think we are quite reliant on getting that feedback from our authors. And, you know, it is the way that I will be measuring the success of the journal, is real world impact. It's not necessarily how the publisher will measure the success of Nature Health. I mean, they know that that's the vision for the journal, and so they do want that real world impact. But they will be looking at other things like citations, successes. And also, I mean, one thing that that I do as well is talk to other journals in the portfolio. So I mentioned Nature Sustainability at the start, and that was very much their goal, was real world impact in the sustainability space. So they have some things that they've done, and I know they put a lot of focus on kind of bringing kind of their convening role, I suppose. So trying to bring people together. So it might be someone's published a paper. Well, they'll bring them together in a webinar with policymakers, for example. So that's another thing we're thinking of. But any other any ideas? And I'm very happy to hear.
It's a challenge, I
Yeah.
think, and perhaps during your interaction with many of us, seek inputs, and then you'll use your own personal intelligence.
Yeah.
There isn't really an agreed upon
No,
method.
no, there isn't.
I'm very heartened by your serious approach to this, and perhaps you may invent a new method.
Yeah, maybe.
That would be called the Johnson impact factor. I think it's not needed.
Yeah. There was a question there and then a question here.
You mentioned before that you even invite reviewers to comment on other reviewers, comments. I really like that. I've never been offered that opportunity to clean things up before you give feedback to the author. As long as you can manage that. But I've never even seen other reviewers' comments, let alone had the opportunity to see, oh no, you totally missed something here.
Yeah.
I that it's carried forward.
So that for the purpose of people online, that was a comments about the reviewers' comments and sharing those. So I think the way, if I remember correctly, so we will share. What we often do is when a paper comes back revised, we will share all the reviewers' comments with all of the reviewers. So you will get to see at that stage, we call it back to reviewers. You will get to see all of the comments from all the reviewers. And, where reviewers disagree, sometimes we even get them on the phone or, webinar, like a Zoom, to discuss, because it might be that we have a sense we want to publish a paper, but the reviewers have some sticking points. So we sometimes do actually spend quite a lot of time on discussing those comments amongst the reviewers to try and, because reviewers quite often disagree with each other, or they highlight different things, and that's particularly the case for us at Nature Health, because a lot of the research is interdisciplinary, so we will try and pick reviewers from different specialties. So we might have a statistics reviewer, we might have a public health reviewer, we might have someone whose expertise is in education, health economics. And so they approach papers from a very different angle. And they may have different criteria for what they consider to be kind of the best quality or the highest rigor. There's a big challenge for us is getting reviewers to agree with each other. Yeah, right.
So just to piggyback on the policy question, so some years ago, there was a conversation that authors should discuss the policy implications, the findings that might not be new to. And so I was wondering if you would be inviting authors to describe and report potential policy implications, or that would be a separate conversation in dedicated papers that this whole team.
Yes, so the question was about whether authors should kind of mention what the policy implications are of their work in the paper. We're open to that within the discussion section of an article, but we also have an article type called policy brief, which, I mean, we've not published anything yet, but Nature Energy pioneered that, and I was discussing it earlier. It was created in the UK with the UK Parliamentary Office of Science and Technology, which serves the House of Commons and the House of Lords in the UK. And it's a two-pager, so it's two sides of paper, so a single piece of paper that you could hand to someone, and the results are all at the start. Kind of policy it's kind of reverse of a scientific paper. So this is what it means for you as a policymaker, and then some one figure and some details of the methodology. So those are written by the authors. So we give a template, and we're going to make use of that. We've got one article already which is around physical activity, that we're going to ask the authors to write that, and it will be a separate article, will have its own DOI, it will be linked to the main paper on the website. Yeah, I think we anticipate it won't be a huge number of those, but maybe kind of 4 or 5 in a year. But yeah, we're very interested in that, and it may be that we come up with other options as well, other ways for authors to talk about those policy impacts. Thanks. Yeah.
Thank you for your presentation. Much of the conversations around AI have focused on plagiarism, intellectual property theft, hallucinations. But I wonder if you've thought about the user's experience of using AI to read and understand journal articles, and whether the journal's thinking about incorporating AI into publication model.
Yeah, we think a lot about that. So we have a whole AI department now. We're part of Springer Nature, the bigger publishing company, and we have a whole AI department that didn't exist 5 years ago. And, we know that researchers are using AI, but we also know that we have this kind of treasure trove of high quality information, which is all of our subscription content, which officially none of the public AI models should be using, because it's, I mean, they probably are, but it's behind the paywall. So we've built our own tools. One of them is called the Nature Research Assistant, and you can put your paper for a fee, I think. You can put your paper into it. It could be in any language, or it could be in a non-English language, probably not any language. And it will rewrite the paper kind of like a Nature paper. It's been trained on all the Nature papers going back. And you can also use it. They're building a tool for us as editors, so that it will summarize the paper, suggest peer reviewers. So we know these tools are being used. And for us, it's not a question of whether we fight it or embrace it. It's really trying to make sure those tools are accurate. And we realized, not me, but the AI people, that the best approach was to build our own tools. And there's a number of things that the large language models, the kind of ChatGPT style tools, are really good at. One of them is summarization. Really, really good at that. If you feed it a paper, it will do a pretty good job of summarizing it. And we've published research highlights across the Nature portfolio that were written with AI. What you can't do, or what you shouldn't do as a reviewer, is put a paper through these tools, because it's not been published yet. It's private information, and then it's helping to feed. It's moving into someone else's area, and that's partly why we're building our own tools. But I can see a number of things that we do as editors where AI could be a real time saver for us. So we're quite excited about the potential of well-trained, probably publishing specific AI tools. Yeah, questions back.
No, please, go.
I had a question. You mentioned something about taking a different approach to causation or something along those lines, and I didn't see you go into that, I don't think. So I was just curious to hear you elaborate on that.
The question was about causation. No, I mean, I'd be very nervous about giving a kind of epidemiology seminar for a public health audience, because it's been a while since my PhD.
The gotcha question.
No, but I mean, I guess what we're thinking, we have a lot of conversations internally. What's our threshold for, say, a single cohort epidemiology study, risk factor epidemiology study? And I think the things that we are getting interested in, it's very early. We've not published anything yet, but we've sent 181 plus papers out for review. are where there are those either methodological innovations or perhaps technical innovations. So one example would be like wearables, I guess. So where you have personal data, maybe movement data, or biomarker data. And so you're not reliant on kind of ecological studies, which have their place, but obviously have every study approach has its issues. So that would be one area where I guess we would have a strong interest in being a home for those kind of studies, which are bringing some technological or methodological novelty to help those thorny issues around causation. Because with some studies, I mean, microplastics is a good example. You have all, Nature Medicine published what was essentially an observational study, right? There's microplastics in people's brains. Not very little, little hints maybe that there might be more in people who'd had dementia at the point of death. But these were cadavers, and it was a really imperfect study. But I think Nature Medicine published that, and I wasn't involved in that decision because there's so little evidence there. So that's as good as we have at the moment. So I think trying to advance understanding of what are causes of disease, particularly those emerging potential causes, is something we have a strong interest.
Okay, so we have two questions from
Oh,
the
great.
online audience. The first being, I'm curious if you might be able to share any of the titles of the accepted journal articles in the first few issues. I'm wondering about what fills the 4 buckets. And question number 2 is what type of work should go to Nature Medicine versus Nature Health?
Yeah, great question. So first question, no. I can't share the titles, but I can give you a flavor. We have a piece on green space and physical activity. So links between the amount of green space you're exposed to and physical activity, breast cancer screening paper, quite a bit on health AI. We have quite a bit on heat and health. That's a kind of flavor. We've covered most of the topics you would expect us to cover. Next week, we're going to assemble our first issue. So we've got 10 papers accepted. And actually, we are going to publish a very small number of papers. The first paper will actually be out on Monday because we're going to publish a few papers kind of advance of the main launch, but we're not doing a big fanfare around them. But the few will kind of quietly go online over the next. And then the second question.
What type of work should go to Nature Medicine versus
Yeah.
Nature Health?
Yeah, so this is a good question, one we get a lot. 2 of us out of the 3 editors were formerly at Nature Medicine. Really, we're a population health journal. So we're most interested if, for example, it's an intervention. So Nature Medicine now is all about interventions. And actually they have a kind of less interest in observational studies than they did in the past. So if you submit an observational study, like epidemiology study, to Nature Medicine, there's a good chance they will say to you, look, send this to Nature Health. This is a better fit there. Similarly, if you submit to us something which is very hospital-based, maybe it's a clinical trial. If it's a clinical trial of a new pharmacological intervention or a gene or cell therapy, most likely that's a better fit for Nature Medicine. So we're more population health and they're more clinical. There is a bit of overlap. I mean, on Monday, the first paper we're going to publish could easily be a Nature Medicine paper. It's hospital-based, it's breast cancer screening. It's not like my first choice for the first paper to publish, which is why we're not doing a big kind of song and dance about it. But it has quite a strong equity angle, which is a really hot topic in AI-based screening in terms of ethnic diversity. So that's why we've decided to go with that paper, because that kind of ticks a box for us. And similarly, I mean, this wasn't asked, but at the other end, the more biological, I mean, as Nature Health, you know, we've had papers around kind of mechanism of disease for neurological conditions or infectious disease. That's out of scope for us because we have a whole bunch of journals: Nature Microbiology, Nature Neuroscience, Nature Genetics. So those we're sending over to those other journals. Yeah.
Curious about a little bit about your journey with the school, which is
Yeah.
what brought you to
Yeah, so how long have I got for my my life story? Um, I mean, I was doing infectious disease research, so at Public Health England and Imperial College London, and then I moved into publishing 15 years ago at BMC. So I was launching new journals, and then I took a real sideways move and moved into running blogs and social media at Nature. So I launched Nature's Instagram account, nature.portfolio, and I was really fully focused on science communication. So how can we help researchers to talk about their research? And we created a blog called Behind the Paper. And the idea was if you published your paper in Nature, you could then tell the personal story behind that paper, like the collaborations you had, the people you met at conferences, the unexpected route your paper took. And actually, it was that led to the Nature Instagram account, because scientists or researchers would have all these cool photos in the blog posts, and I thought, well, we should be we need a venue to share all of these photos. So I was doing that when the COVID pandemic started, and my background was respiratory viruses. And so Nature Medicine was getting, you know, hundreds and hundreds of submissions about SARS-CoV-2, and they asked me to help out as a kind of consulting editor. So I did that, and then they offered me a job, and I'd started off as an editor and had quite a break from the content, and then moved back to that. And so I was doing news and opinion at Nature Medicine. I wasn't handling research. And then I never imagined being a chief editor, because it never looked like a very appealing job. It just looked like a lot of work and headaches. But then when Nature Health was announced, I didn't apply for the job. They actually advertised the role a year ago or 2 years ago, and they didn't get the right candidate. They re-advertised a year later, and I thought, okay, this is actually, they kind of reframed it, and I'm just really interested in policy, in public health, in real world impact, in kind of social sciences, behavioral sciences, but that's not my background. And so this was kind of the one role I thought, okay, if I'm going to go for a chief editor role, it would be this one. So that's it in a nutshell. Thank you for the question. Yeah, I'm not sure who's first. We'll come to you. And at the back, yeah.
To what extent geography might play a role in your sort of considering appropriate articles? We're here in New York City. A lot of the work we do focuses on New York City populations, or certainly not exclusively. And then, you know, there's national studies. I'm just wondering, given when you're thinking of the audience, what would be maybe not so appealing geographically, unit-wise?
So Ayman asked the same question of me earlier, and it's a really good question, and we do discuss this a lot internally. We kind of see you know, global is always nice, but in terms of real world impact, sometimes it's the local studies that have more real world impact. So the smaller the location, the more we would really look for that real world impact. So we have papers. I have a paper I've accepted, which is a single city study actually in Paris, because it's an outbreak study. And they've just got a really nice data set. They've got real world impact. Other studies we have are global. So all of it is potentially in scope, but if it's just New York City, we really want to see that real world impact. Question in, and then a question at the back.
And you mentioned that you prioritize research resource limited settings.
Um, it's a priority. And sometimes what that means is it's there in the paper, but it's not been sufficiently explored in a way. So sometimes we would ask researchers to do a bit more analysis to look at, say, an equity angle in their article. That's the case with the first paper we'll publish on Monday, which is a breast cancer screening um, paper from the US, from hospitals in the US. In a way, the reason we've said that is not because we won't publish things in a high income setting. We will. We have papers that are from high income settings. Really, the reason we've said that is to say we are a home for your research. If you're in a lower middle income country, or all of your research is in a resource limited setting or a deprived neighborhood, that it's more the message, because that research often has been hard to publish in a kind of packed journals or like within the Nature portfolio. You don't think Nature, oh, it's all about resource limited settings, right? So it's not that it's exclusively that, it's more a message for what our vision is for the journal, that we are also a home for that research and we will champion that research. Because I think if we didn't say that, we probably wouldn't get any submissions that were of that type of research. Sorry, you've had your hand up for ages. Sorry.
So, I think a general critique of publishing, scientific publishing, is that it favors sort of the same types of papers over and over again. And, there's the whole system in place. I remember like, 2009, I was talking to the editor-in-chief of one of the top journals, and the editor-in-chief said, oh, we don't take any AI papers at the time. Of course, now it's hot. So I guess the question is, especially since, I anticipate, or I think many people anticipate the nature of research and those things to change quite significantly in the coming years with, data availability and all big data and all these different types of things. What are your thoughts of how, maybe sort of the publication process or system can change to encourage different types of research, different types of research structures, research processes, those things like that?
Yeah, that's a great question. And we discuss that a lot internally. I mean, there's just the three of us full-time editors, soon to be four. I'll give you one example, is qualitative research. So I only know via an author who submitted their paper to one of the Lancet journals that they got a just up, we don't do qualitative, which I actually didn't think was the case. But that was the response. And obviously they have their reasons. They have their reasons for that. We discussed that internally, and we have sent some papers out which are qualitative. They're kind of like focus group studies. And whenever we're handling an area we're not used to, it's hard. We don't know the field that well. We're not quite sure how to assess impact or methodological rigor. We don't know the reviewers who are working in that area. But we're really open to going into those new areas. New for us, another area would be health economics, which we don't have great experience as editors, but which we have received some papers. So yeah, we're very open to looking at those kind of, I mean, they're not new areas, but they're just new for us. And there will be areas which are emerging. Another really emerging area around AI is the kind of ethical, legal, and social issues around AI adoption. So what do you think as a patient? How do you react if you're told your diagnosis has come from AI, from a doctor, or from doctor plus AI? There's very little of that kind of research happening. We've had some of it sent to us because my digital health editor knows all of these people. That will be another example of an area which it's not, it's a kind of behavioral science paper. So it's not something that Nature Medicine, I know it's an area that Nature Medicine is not that interested in as a journal. They want to publish the clinical trial of an AI intervention, but we're open to that. I think as a new journal, we can have that flexibility. So yeah, we discuss this a lot, and we're trying to at this stage be very inclusive of those other areas. But I can understand why other journals don't do that, because it's really difficult. But it's really hard to assess the kind of rigor and impact of a paper in an area you really don't know that well at all.
Thank you.
Yeah.
I just wonder if there's any approaches you thought about in terms of getting reviewers. I was a Elsevier editor for 13 years, and one of the hardest parts of the job was getting good reviewers. And one of the innovations or practices we adopted was encouraging people to ask us for letters for their tenure file, to document how many times they did a review, say something about their reviews. There have to be better approaches,
Yeah.
getting the right people to review.
Yes. There's a few things we're doing kind of from the high tech and the low tech. So very low tech, one thing we have is I can't remember what we call it, but it's like an early career researcher reviewer scheme. So now we've just adopted this about 2 weeks ago at Nature Health. In our invitation emails, it says if you know someone maybe in your team who's kind of a junior, maybe even a PhD student, you could co-review with them, so they could work on the review, and you could kind of guide them. So that's instantly increasing the pool of potential reviewers, because you may not have time, but there might be somebody in your group who you think actually they know this area really well, but maybe they've never written a review before. Another thing that I do, one of the challenges is, and from my position, it's a nice challenge, is this huge rise of high quality health research coming from China. But the reviewer base has not increased with that, right? So there's a number of reasons for that. But whenever I go to China regularly, whenever I do that, I'm always asking people if they will review for me. So I have a pool, I have like an Excel sheet full of Chinese reviewers who are real experts in their field and who are not invited to review that often. And so that's something just very kind of low tech I'm doing, building a network. And then the high tech, I think AI, again, it will be a really useful solution. We have a reviewer finder tool, which is okay. It's not kind of perfect, but AI is great at this, right? If you just say or suggest, suggest a restaurant I should go to in this neighborhood, it's the same kind of question, right? Here's all the food I like. Here's the restaurant. Here's the topic of the paper, or here's the abstract. Here's the person who can review it. So we're building those tools. And I think that in the relatively short future will be super helpful. And I'm sure Elsevier are doing something similar where we'll have those tools available to reviewers, because it is easily the biggest challenge that we have as editors. Yeah, please.
I was thinking about you speaking about mis and disinformation, and we know that good information is often behind a paywall, but disinformation is free.
Yeah.
And so I was wondering if you could speak a little bit about author publishing costs, and especially I'm thinking about low and middle income authors who might not be able to afford to get their papers open access.
Or low income researchers in
Or
high income countries.
Yeah, thanks for that, Jeff. You just made the question harder. So in terms of the business model, we're what's called a hybrid journal. So we publish subscription and open access content. So you can publish your article subscription, there's no cost, but it is behind the paywall. Or you can publish open access and there is a fee. The fee is really high. Like for Nature journals, Nature Communications is cheaper, but it's like $10,000. It's completely crazy. If I don't set that number, it's the same across the portfolio. All the Nature journals, it's the same cost for publishing open access. If you're at a low or lower middle income country, then you can publish open access for no cost at all. So I was in Rwanda earlier. Yeah, so I was in Rwanda earlier in the year, and so all of their researchers can publish with no cost. That is where the corresponding author is based. So we look at it's all done automatically now. We're not involved in any of that. On the flip side, I agree with you. A lot of content is behind the paywall. There's something called Research for Life, which makes all of the nature journals freely available, again, in lower middle income. So actually the challenge in a way is exactly what Jeff has said, is when you're in a high income country or a wealthy university and you yourself are struggling with that fee. And honestly, we don't have a solution for that.
You really need to advertise this very aggressively.
Mm.
Just put author on the paper. And they submitted it to a regional paper unknown to me. When I asked the author, I could have picked the fee, they didn't ask.
Right,
I
yeah,
said, why did you submit to this journal?
Yeah.
It was firm.
yeah,
They said, because they asked for no fee.
right,
So that's
Yeah.
already, your consumers already
yeah.
have a misconception. They wouldn't know that nature would give them preference.
Yeah.
as they come to certain
And the bizarre thing is sometimes we don't know as editors because we're not setting these policies. It's a separate department. We had authors from we have a paper, an health AI paper with the authors in Pakistan, and they automatically got this waiver offered, which we weren't involved in at all. So that worked. In that case, it worked really well. But yeah, I certainly, whenever I'm giving talks, like I got the same question yesterday at Columbia. So it's I think we do have that, at least that kind of fund for lower middle income countries. And I mean, it was explained to me by someone internally, and I don't know if it's helpful. The reason you pay so much is because they pay nothing. So actually, that's why the cost is. That's why the
That's the marketing.
But if we were fully open access, we wouldn't make a profit. So it's really expensive running a nature journal. Any other questions? Yeah.
I guess that raises a question. I mean, there are a lot of interesting market forces right now happening, right? So there's the proliferation of huge proliferation of journals, including ones which are from all kinds of different places and some that really just want to make money as opposed to and so that gives authors a lot of options in theory to submit. The fact that things are all electronic now, like you can like submit just tons of things. And you also mentioned reviewers are hard to find. So the big question is, are we headed towards some type of situation where, publishing will have to change dramatically? There's also the issue of people posting things on, the RX servers before they actually reach the journals. I don't know if you have any thoughts about that and what do you feel needs to be done, or is nature doing things to sort of prepare for all these?
Yeah, there's a bit of a paradox here, which is that as there's more options for where to post your research, in a way, having a trusted source becomes even more important. So we're very supportive of preprints, and you can publish your full research paper on a preprint, and that's not a barrier to publishing in a nature journal. It's absolutely no problem at all. So you can have that freely available as soon as your research is ready, and then while your paper's going through peer review. But I think there is, we're not the only game in town. There's lots of great journals out there. But I think in a way there is an increased need as there's more and more information, and not just in health and not just in scientific publishing, but just in general, of having a kind of having trusted sources of information. Yeah.
I mean, can you tell us how many already people sent your way for nature medicine after they knew that you are now ready for action?
Yes, it's about 1 in think it's about 15% of the papers that we've got are transfers, not just from Nature Medicine, but also from Nature. So Nature now has a dedicated public health editor who is based in New York City. First time ever in its history, it's had a dedicated public health editor. So she is sending papers our way as well.
Follow-up commentary to that is, it's always good to, in Nature Medicine, to see articles that are population health
Yeah.
focused, because you want the readers of Nature Medicine to get that kind of an education.
Yeah, I
You see a
agree.
downside in not having any of this Nature Medicine? You think it affects readers?
Yeah, that is a great question. And that was the question. So Nature Medicine has a dedicated public and global health editor. And that was his question was, am I going to be made redundant? I'm going to be fired because now we have Nature Health publishing all of that. I think there still is a home for those types of papers in Nature Medicine. I think they just, it will only ever be kind of a tenth the content in Nature Medicine. But my understanding is they will, there still will be some of that content. They're just, that it will never be a huge amount of what they publish. But I really agree with you, because the medical community needs to see these types of research. Yeah.
So please join me in thanking Ben.
Thank you.
Thank you. We're in very good company here in New York.
Yeah.
You only visited the best. Thank you so much.
Indeed. Thank you.
Appreciate it.
Thanks, Simon.